Lancashire Care provides a wide range of health and wellbeing services across the county, and an important part of that are our services for people with mental health problems. The vast majority of those people can be very well supported in their own homes, but when people are very unwell, then they need good quality inpatient facilities. We do have facilities across the county right now, but they're not of the quality and standard that we think people deserve. So we're committed to building some new ones, and the Harbour is the first one of those, and we're delighted it's going to be a state-of-the-art facility for people who need it when they're really very unwell.
We've been supporting this development by our development partners Ryhurst, and also the project managers and cost consultants Deloitte Real Estate and Davis Langdon. This is a significant development for the Trust. We're building 154 beds here in 8 wards. The overall build cost is about £40 million, and added to that we have VAT, fees and the cost of purchasing this overall site.
This is the first of 4 facilities for Lancashire Care that will be produced over the next several years. The intention is to make sure that this one, finished and occupied by 2015, is the exemplar, and it will create the precedent and the learning that will enable our later facilities to pick up on that best benefit.
Gilling are experienced healthcare architects. We work in the acute and mental health sectors. The Harbour is probably one of the biggest mental health projects we've been involved in the last few years. All our successful projects have one common theme, and that is meaningful and long-term service user engagement. The Harbour has been no exception to that. We've done a lot of work with the service users. A lot of it involves listening, a lot of it involves responding to what we hear at the meetings. Open dialogue. It's an ongoing process that we don't want to dip in and out of, hence the service users are part of the design team.
We've had a lot of influence.
Well, we was listened to, which I was surprised that they listened so well.
They've involved us. They've made suggestions that we could either agree, disagree or come up with a different idea.
Well, we wanted single rooms with their own showers and televisions. They were all on ground level, which we wanted them to have. Yeah, I'm quite happy with the way it's all worked out, and I can't wait to see it built.
This is a mock-up space that's been created basically to reflect the scheme that we're about to deliver. It has taken many people many months looking at a 2D drawing. What this one does, it brings in what I call a Z factor that makes it 3D so you can feel the space area. This portrays exactly a fixed bed position, allowing a clinical team to sit alongside a service user that might need assistance. And then associated with it, this whole room is reflecting anti-ligature requirements. So we have a window here that is anti-ligature window. Adjacent here we've got a wardrobe area, a desking space and personal space with TV set, and alongside we have a dual assisted ensuite facility. Clinicians will be assisting the patient into the area. We have a shower space, a toilet and a hand basin, and this is a developing space, and that ensures that what's physically delivered in the final facility ticks all the boxes.
In terms of environmental and sustainability issues on a project of this size, we do have an existing wetland area here which we're very conscious of. We've had to protect that, but we also have works to enhance that by forming a new wetland area. In terms of labour for the project, wherever possible we'll be sourcing labour from the local community. In addition to that, we're involved with a business called Blackpool Build Up, which provides training for adult learners, and we can source labour from those guys as well.
The Harbour will improve patient care considerably to what we have now. It will enable a recovery approach to that care and enable people hopefully to get back out into the local communities a lot quicker than we're able to at the moment.
And the fact of having individual bedrooms will give much more privacy and dignity to patients' experience, which actually helps their recovery. and helps us develop individual plans, because you can help them with making their beds or taking their self-medication. We're in their own bedrooms, where at the moment we're in dormitories and you can't do that. So it'll improve the experience greatly from that level.
The investment for the Harbour in particular is going to be worth every penny spent. The Harbour will be the best of the best.